Okay, so good morning, students. So today we will be starting on the topic of shock. So, by hearing the word shock, what do you understand? What comes to your mind if I say shock? Can anybody say shock? If I say shock, what comes to your mind? Anyone?
Heart attack.
Heart attack. Okay. Anyone else?
Ma'am, shock is a condition developed by severe blood loss.
Severe blood loss. Okay. Somewhat partially correct, Darshana also. Okay. Okay, let's see. What do you mean by shock? Okay, so the term shock, it comes from psychological perspective, or else you can say, means in medical word, in medical term, like if we will understand, like if we will go in deep, so it means what? When your body, when your body doesn't have like enough blood circulation. Okay, means the normal condition, the normal way how the heart was circulating blood to the different parts of the body. There is no enough blood like circulating all around your body anymore. So that's why shock occurs. Means your body is not functioning properly, or else you can say your body is not functioning normally again. So that's why uh, shock usually occurs. And in psychologically, like like if we will go, so psychologically it means what? Trauma means like something, stress disorder. Okay, like if somebody tells you like which is very out of your expectation, or means anything, like it might be because of acute stress disorder also. So we won't go that much in deep in this psychological shock. We will discuss mainly about this, that is uh, in medically, when the body does not get enough blood circulation throughout the entire body. Okay, so this means shock. Okay, did you understand the first part?
Yes, ma'am.
Okay, so the next one is causes of shock. What can be the causes of shock? So the causes may be because of some injury, like a person is having some injury, or it might be because of some blood flow which is not functioning, means because of that accident, or because of that like injury, what will happen? The blood won't flow normally anymore. So that's why maybe because of that also shock can occur. And because of that, I mean because of that abnormality, or else what to say, insufficient blood supply, what will happen? The means all the organs, like multiple organs, it will fail. It will fail to what? It will fail to function normally, or else you can say function properly again. So it will lead to multiple organ failure, which is life threatening. Life threatening means what? Means which is not good. Okay, means which might lead to death also, like which can lead to uh, what to say, which can, yeah, which can lead to death. You can say a person can lose his or her life because of this multiple organ failure. Why? Because the blood is not circulating normally anymore because of this thing. Okay, because of this shock, because of this injury. That's why. Okay, did you understand till this portion the causes of shock?
Yes, ma'am.
Okay. Okay, next is complications. Because of this shock, what are the complications a person will face, or a person can face? First is ARDS, shock in the lung. ARDS is also known as acute respiratory distress syndrome. Acute ARDS means acute respiratory distress syndrome. Understand? So what happens here, like the person will have abnormalities in the lungs because the blood is not circulating normally anymore. So obviously the person will find difficulty in breathing. It's not it. So that's why the person will feel distressed. The person will feel some, what to say, mm, some difficulty. Okay, the person will feel some difficulty. The person will feel some abnormalities in the lungs. Means the person will feel uh, disturbed. The person will not be able to breathe like the normal days, how he or she was breathing. So it will affect the lung. Okay, next is acute renal failure. So the next one is acute renal failure. So what will happen in the kidney also? It will affect. It won't function normally anymore. Like it will fail. It will fail to function normally. So then the second is this, and the next one is gastrointestinal ulceration. So what will happen? The next thing, what will happen in shock means even in your digestive system also, in your digestive system, mainly in your intestines, it will affect. There will be ulcer, there will be inflammation because of this shock. Next is dissemination intravascular clotting. So what will happen here in this dissemination intravascular clotting uh, means it will lost it will lose the ability to clot and it will stop bleeding. Listen, what will happen? There will be lots of blood clot. You know the blood clot, like the thickness means when you bleed, what will happen? Like um, if you want tap or if you want treat the blood clot. I mean, if you are bleeding and if you want treat it like instantly, what will happen? There will be blood clot. It's not it. So that one it occurs normally. It's not it. The blood clotting. But in this dissemination intravascular clotting, what will happen? There will be lots of blood clot, lots of blood clot inside. And what will happen because of that blood clot? Obviously the blood it won't be uh, able to function normally again. Like the circulation process will be abnormal. So that's why shock arises. Next is multiple organ failure or multi-organ failure. So because of failure of blood circulation to all the different parts of the body, so there will be organ failure. Means the all the organs, whatever organs now you are having, like they will fail. They will fail to function normally, and ultimately it will lead to death. Is it clear? What are the complications of shock?
Yes, sir.
Overall, you can say because of abnormalities in blood circulation. You can say overall, all this. Okay. Okay. So shock, you will be getting four kinds of shock or four types of shock. First is hypovolemic shock, cardiogenic shock, obstructive shock, and distributive shock. So let us see one by one what do you mean by hypovolemic. Okay. First of all, let us discuss about obstructive shock. So this one, obstructive shock. So in obstructive shock, what will you find? You will find that your heart will function. Okay, it will obviously it will pump, but what will happen? Uh, there will be abnormality in outflow. Means whatever blood will come out, now there will be abnormalities. Means since there will be blockage, since there is blockage in the pathway of the blood flow, what will happen? Obviously it will break, I mean it will hamper, right? So that's why there will be abnormalities in the passage of blood, since there is blockage in the outflow. Blockage in the outflow means from where the blood will come out. Since there is blockage, understand, since there is blockage, so obviously the blood it won't be able to pass through this way anymore. It's not it. So that's why obstructive shock occurs. Understand? The second is cardiogenic shock. This is cardiogenic shock. So what will happen in this cardiogenic shock? In this cardiogenic shock, you will find that the heart is unable to pump. The heart means it will lose the ability slowly and steadily. It will lose the ability to pump blood. How much? Suppose, say for example, the heart beats in 1 second. How many times does the heart beat? Do you remember? Pulse? Anybody? Per minute? How many times? Uh-huh. What is the normal range? We have already studied this. It's not new. How many beats? Yes, how many beats?
Ma'am, 70 to 80.
70 to 80. Okay, normal is 60 to 100. Okay, say for example, normal it starts from 60 to 60. All right. So suppose, say for example, it will beat 40 beats per minute. So it's not enough for that person anymore. It's not it. So it means that cardiogenic shock, it means that means they won't have the ability to pump blood anymore like previously how it was pumping, right? Okay. Are you clear about these two shock, that is obstructive and cardiogenic shock?
Yes,
Ob-
ma'am.
okay, I'll repeat again. Obstructive means like since there is blockage in the outflow, means from where the blood will pass, na, there is blockage. So that's why there will be, there will be shock. This is known as obstructive shock. Next is cardiogenic shock. Cardiogenic shock means whatever ability, like the heart was pumping, but then the blood, so it will lose the ability to pump blood. Like previously, how it was pumping, it won't pump in that manner anymore. Okay. Okay. Next is distributive. Sorry, distributive shock. So in this distributive shock, what will you find? You will find that there is abnormal distribution in the blood flow. Okay, there is abnormal distribution in the blood flow, and your blood vessels uh, means it will not be sufficient anymore. Understand? Okay. So what will happen since there is abnormalities? All right, since there is abnormalities in the what in the blood flow, there will be there won't be enough, or there won't be sufficient amount of blood which will flow, or else which will pass to your body tissues and your organs. So obviously, like, because of that, what will happen, there will be distributive shock, because the blood will go and supply to the different parts of your body. It's not it. So since there is like what to say, since there is abnormalities, or since there is insufficient amount of blood supply to the different parts of the body, so that's why distributive shock arises, or distributive shock occurs. Okay, is it clear about distributive shock?
Yes, ma'am.
Okay. Okay, next is hypovolemic shock. So this is volemic shock. So in this hypovolemic shock, what will happen? There will be severe loss of blood, as well as some body fluids. Okay, so there will be severe blood loss and as well as body fluids, which will make the heart uh, which will make the heart uh, unable to pump the blood. Understand? I'll repeat again. Hypovolemic
Espera
shock.
que
Hypovolemic shock. What does it mean? Since there is severe blood loss and as well as body fluid loss, the heart, it won't have the ability to pump uh, enough blood anymore. Understand? So that's why hypovolemic shock occurs. So these are all in brief about the different types of shock. That is hypovolemic shock, cardiogenic shock, obstructive shock, and distributive shock. Is it clear, everyone, about the four types of shock? Yes? Okay. Okay, next is risk factors. Who are at the risk of having this shock? Means किस किस को ज़्यादा risk है ये shock होने पर? Okay, first is older age. Means elderly people. Okay, जो बुजुर्ग है उन लोग को ज़्यादा chances है ये shock होने को. Next is heart failure. Obviously, it's related with the heart. हार्ट फेलियर ऑब्वियसली होगा क्योंकि ये तो हार्ट से रिलेटेड है कि नहीं ये जो शॉक है तो ऑब्वियसली बिकॉज ऑफ the abnormalities in the blood circulation which we will find in the heart, so obviously because of that uh, they will be at the risk. Next is high blood pressure. So whoever are having high blood pressure also they are at the risk of having um, this shock. Next is diabetes. So diabetes is also included in uh, the risk factors of shock. Is it clear? First is older age, people who are elderly people. Next is heart failure, whoever having like problem in the heart, no? Like heart failure, then high blood pressure. All these are at the risk of having this shock. Next is diabetes, whose blood sugar is high. Okay, glucose level is high blood sugar, cholesterol. So they are at the risk of having shock. Is it clear which factor? Okay. So next is effects on the body. So if a person is having shock, so what will be the abnormalities that you will find in that individual? Okay, first let's see. Obviously, there will be dizziness. Dizziness means what? Sir mein chakkar, the the head it will rotate. Okay, means it will go round. Dizziness. Next is drowsiness, irritability, anxiety, fainting. So it's all related with this head. Okay, irritability means what? Means the person will find irritating. The person will have anxiety means because of stress. Understand? Next is fainting means it can lead to unconsciousness also, like behosh hona. So all this you will find. Next is enlarged pupils means the person's eyes, no, the pupil. This is pupil. The pupil will be enlarged. Enlarged means it will become bigger in size. Next is fast pulse. The pulse rate. The pulse rate also it will be what? It will be fast, very rapid, not like the normal uh, pulse. Next is shallow and rapid breathing. Means shallow means deep breath. It means the person will find difficulty in breathing. Understand? The person will find difficulty in breathing, so the person will take a deep breath, and it will be very rapid. Rapid means it will be very fast. Next is excessive sweating. So the person will sweat, means pasina aega, too much sweat. Next is nausea or vomiting, means the person will feel means what to say urge to vomit. Okay, nausea. It's known as nausea. Next is blue or gray fingernails or lips. Means in the lips as well as in the fingernails, na, this all these nails it will be blue or gray. Why? Because the blood it's not circulating normally anymore. Understand? So that's why it will turn as blue or gray. Next is cold, pale or clammy skin. Means the person skin it will be cold. Understand? It will be cold. It will be pale in color. Pale in color means somewhat what dull, very dull. Understand? Very dull. Next is Calmy skin. Calmy skin means it sweat. It will sweat. Understand? So it means that Calmy skin. And one thing you will also find in shock is hive. 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 Hive skin. Hive. Hive means what? Means uh, too much. If you will scratch your body too much, what will happen? There will be red dot spot like that. It's not it. So that one is hive. So sometimes you will find that one hive. Hive skin. Is it clear till this portion?
Ma'am.
Okay. Okay. So what can we do? First aid treatment. If a person is having shock, um, and if a person is like unconscious, what can we do? We can give CPR. CPR is known as cardiopulmonary resuscitation. This one is important. It will come in your exam. Okay, what is the full form of CPR? So CPR means cardiopulmonary resuscitation, or else you can say BLS. BLS. BLS means what? Basic life support. So this is the treatment. So this is the first aid treatment that we can give if a person is unconscious, maybe because of shock. It's not it. So it's important also, like give this CPR. So from the name itself, cardio. Cardio is related with what? From the name itself, cardio means
Heart.
heart. Okay.
Heart.
Pulmonary. Pulmonary.
Ma'am, lungs.
Very good. So it is related with these organs. Okay, that is your heart and your lungs. Okay. So I have given uh, some picture on that. Means CPR, how to give a person. So first of all, what you will do if a person is like unconscious, or if a person faint, agar ek insan behosh hone se, means what will you do is that first of all, you have to shake that person, and you have to shout means what? Means if a person is a male, you can say means brother, sister, right? So you can say, can you hear me? Can you hear me? You can do in that way. Why? Because maybe it might be a person like have just like, because of some dehydration or something like that, a person might just faint it. All right, so that's why it's very important, it's very crucial, like for you to wake that person. If a person is having shock, obviously the person won't respond to you, it's not it. So what you need to do, you won't need to give CPR anymore if a person will respond to you. Understand? Means if you see anybody like fainting on the floor, or if you directly give CPR, what will happen? Obviously it will get affected. Means you will push hard, isn't it? Like this you will push it, isn't it? So it will affect this sternum. Your sternum is right here, right? So it will affect that if you give too much pressure. So what you need to do, you need to uh, shake that person. Shake, that means it's not that you need to shake the whole body like that. A slight shake, or else you can call that person Mr. or Mrs. or Miss so and so, like you can call that person. Okay, so if a person will not respond to you after you shake or after you call out him or her, what you need to do, you need to call emergency. Okay, 108. No? So you need to call that. Here is written 911, but it will be, for us it is 108, emergency. Okay, so when all those frontline workers, means emergency people, will be on the way, what you need to do, you just don't need to wait them. You can have that person, you can check if a person is breathing or not. Understand? If a person is breathing or not. So mainly we use carotid pulse in this case. Why? Because it's near to you also. It's near to you also, as well as we mostly get the prominent pulse in this carotid. You know the carotid, this is a carotid. So we will check the pulse in this carotid. Okay. So if you, after checking, like you will be, after checking the pulse, okay, wait, let me show you here, it's more clear. Okay, first is you need to call, okay, and second you need to call the emergency number, what that is 108. Second step, you need to check the vital signs such as a person is breathing or not, and you need to check the carotid pulse. Understand, you need to check the carotid pulse, and after that you can lift up the chin. Why? Because if you lift up the chin, it will be easy for you to check whether the person is breathing or not, um, as well as on you will also, the person will also find a bit, what to say, easy in breathing. Okay, and next is you can also lift the person's leg, elevate the leg. Why? Because I already said now, means it is good for blood circulation, that's why you need to do that. And if possible, you can also give breathe, rescue breathe. You can breathe in that person's mouth, mouth to mouth breathing. Next is you can perform CPR. Understand? You can perform CPR. So you have to do like this, and you need to press in this manner. Understand? And by then, mm, if the emergency comes, like they can handle the situation. That is 108. Okay, is it clear till here?
Yes, ma'am.
Everyone, is it clear about shock today's class?
Yes, ma'am.
Okay, it will come in your exam, all right,
So,
in your final exam. It's important. You need to know the causes of shock, types of shock, full form of CPR, all this. All these are important for your exam. What is the full form of CPR? Senkamchi. Senkamchi, can you hear me?